Today we're going to be talking about what MRSA is. This video is brought to you by the Northern BC iGEM team. So, what is MRSA? In simplest terms, it is methicillin-resistant Staphylococcus aureus. This means that it is a bacteria resistant to antibiotics, which is a big problem when we are trying to treat it in a patient. It is a prominent human pathogen that can cause infections from minor skin infections to infections that are life-threatening. It was first reported in 1961 in England. The first case in America was in 1968, and the first case in Canada was in 1981. MRSA commonly lives in the nose and on the skin of humans. Many people carrying it do not show symptoms, but those who do will commonly show swelling on the skin, which can progress into an abscess. Sometimes the infection will stay on the skin, but it can also progress further into the body, resulting in a much more serious infection. These infections are very hard to treat due to the antibiotic-resistant nature of MRSA. A lot of MRSA infections occur in people who have been hospitalized or are in another healthcare setting for an extended period of time. These infections are generally associated with patients who have undergone surgeries or other invasive procedures. Rates of infection are highest in elderly and illicit drug users. However, MRSA doesn't just infect humans. It can also infect livestock, wildlife, and pets. Transmission factors include cleanliness, crowding, contact, sharing contaminated items, and compromised skin. In order to prevent the spread of MRSA, we can wash our hands regularly, keep wounds covered, do not share personal items, such as razors, bed sheets, and athletic gear, and wash personal items regularly, such as sheets and towels. It is important to remember that MRSA spreads through contaminated objects as well as people, so sharing personal items can also result in the spread of MRSA. Thanks for watching.